You're listening to the Travis Makes Money podcast. Hey, what's going on, everybody? Welcome back to the Travis Makes Money podcast, where it is our mission to help you make some more money. Today on the show, I am talking about healthcare and how you can maybe make some money back when it comes to your healthcare provider. And so I'm going to talk about that with Matthew Ungs. Matthew is the founder and creator of Patient Fairness, a one-of-a-kind website and tech platform that's dedicated to helping people lower or eliminate unfair medical bills across America. Patient Fairness helps patients stick up for their rights as consumers and challenge instances in which they are not treated fairly and or overbilled. Now, this is a topic that's near and dear to my heart and top of mind for me because I recently kind of went through a little bit of a health scare myself. And one of the worst parts about all of that was dealing with our terrible healthcare system. So talk to me, Matthew, about how you got into this. Why did you start this particular venture?
Sure. So I spent, Travis, I spent about 30 years managing provider networks for health insurance companies like Blue Cross or United Healthcare. And so I was the person and my team that was responsible for negotiating what rates the insurance would pay. And that ultimately impact patients because co-insurance and deductibles and other things are based on those rates. And really over those 30 years, I realized, and this isn't just unique to me, although it didn't help my self-esteem, is the costs kept going up and up.
Yeah.
We in the health insurance business were not really controlling the costs. Premiums were going up, the costs of services were going up, and providers and health insurance companies during those 30 years were doing really well financially.
Yeah.
But the patients were stuck with high premium for the insurance and ridiculous costs on their deductibles and co-insurance. And even worse, those people that don't have insurance, those prices that the insurers negotiated spilled over to the uninsured side. So I just saw what I was doing in my role. I didn't feel like I was really contributing a whole lot to the overall good. And I saw a lot of opportunity where patients could learn from what I knew about the inside track of working with these hospitals and physicians of where the opportunity was to push back and say, no, I don't owe this, because patients, for a lot of them, go through healthcare and sort of look at it as, hey, I'm just a passenger on this ride.
Yeah, right.
Whatever happens, including the bill that comes my way, and I just need to deal with that when it comes. And in reality, you need to deal with it, but there's opportunity to say you don't have to accept it.
But maybe dealing with it doesn't mean paying it.
Right.
Yeah.
Dealing with it could mean pushing back just like you would in any other environment where you're the consumer and say, look, I didn't agree to pay this. Maybe I owe you something for this service. I'm not saying I don't, or maybe I do think I don't owe it for other reasons, but don't be afraid to push back and say, look, I'm challenging this. It takes two parties to have, a purchase, a buyer and a seller.
Yeah.
You're the seller. You have a right to send me a bill, but I as a consumer have a right to say I didn't agree to these terms.
Yeah.
So let's work out something where we both agree.
That is the big deal. Yeah, they can just make up whatever they want.
That's
and then
true.
Send you an invoice and be like, all right, pay it.
Exactly.
And then they want it now. So like the annoying thing for us was that we just kept getting lagging bills in the mail, just like 7 months after something would happen. And then I think what happens a lot of times is that most people just see it and they go, well, got to pay the bill. And then they just go pay the bill. But what happened really recently, which you'll probably find interesting, this was for some work that happened that I had done probably July of last year, just a bunch of tests at a radiology office. And January of 25, so 5-6 months later, we had a $1,500 bill emailed to us. And I was like, well, that sucks, but I guess we got to pay it. And I'm blessed to be in a position where I can do that, because that's also the first thing, like that's something that causes so much debt for people is medical bills. And it makes sense when you're not expecting something like that and all of a sudden you get hit with a big bill. And then I was about to pay it and my wife was like, hang on 1 second. There's something I wanted to check on first. So she calls, turns out it was already paid from the insurance provider.
Yeah.
And we were just about to drop another $1,500 and they would not have caught that.
Right.
They would not have offered us a refund because their records matched, or like they would just be like, it wouldn't have even like been a blip on their radar because they
Right.
have so many billables
Right.
coming in. But we would have been out $1,500
Yeah.
for something that we didn't have to be out $1,500 for.
Right, right.
And we were so close to do. I literally had the invoice up on my computer with my credit card in hand, and then the last second I was like, let me just run this by my wife and see if she remembers, because she's the one that sets up all of our medical stuff. And she was like, I want to check into that real quick.
Yeah. Yeah.
2 days later, like, oh yeah, you don't have to pay that.
Yeah.
Wait,
yeah.
what? Who sent this invoice? You know what I mean? Like, you guys didn't double check? That's crazy.
Right.
But it happens every day.
Yep, no question about it. Yeah, patients. I think insurance industry and providers are kind of to blame for it. But insurance plans used to be all about, you don't worry about anything, just show your ID card. It's a $10 copayment, and that was true 30 years ago. But things are so different now that if you're not on top of things, or at least looking to a service like patient fairness, where you're double checking things or looking for opportunity to say, maybe I don't owe this, or at least the way you build it.
So how does patient, sorry to cut you off.
Sure.
How exactly does patient fairness work?
So
somebody?
In essence, we help patients dispute medical bills. And the way it works is anybody can sign up for our service for free, open an account. And if they're going to upload their medical bill and then the insurance information, so a bit of information about what their insurance company paid, documents like that. If they're in collections, we'll take that information and extract it through AI and pull out the relevant information. The customers will answer some more questions for us, like, was this a medical emergency? Did you authorize the provider to accept payments directly from your insurance company? Things like that. And then we'll come back to them really right away and say, we found these issues that we recommend would go in a letter of dispute. So if we don't find any issues, we'll let you know as well.
Yeah.
But if we do find issues, and those issues can be legal issues, meaning there's some consumer protections either on the federal or local level. The No Surprises Act is a name of a law some people might know, just because that was at the federal level a couple of years ago, which give a lot of protections against what's called surprise billing. But look at whether or not, in using your example of whether something was already paid, your insurer already paid it, and you don't owe that amount of money. There's hundreds of reasons we look for. We come back and let the customer know we found these issues, and then at that point, the customer can decide whether or not they want to open a case with us. And if so, it's $49 to open a case. There's depending on how large the bill is, there could be another payment in 60 days. But we'll send a certified letter of dispute to the provider. We'll help the customers, the patients, manage that in terms of looking at what response they get. We'll give the customers insight to say, hey, you got billed $1,500. Did you realize it costs the hospital $100 to do that X-ray?
Yeah, right.
Yeah, based on the reports they file with Medicare, that really cost them $100. Or Medicare would have paid $200 for this. So maybe you think $1,500 is fair. That's up to you as a patient. Nope, we're not telling anybody what to do. We're just giving them information, and really it's up to the customer. We always put the customer in charge and let the customer handle the dispute directly. We offer those services to support them. But one thing is, in my 30 years experience, patients get a lot better service and attention from their patients than they do third parties. So if it was me back in my day as an insurance employee walking into the office of a hospital, they didn't particularly enjoy seeing me. That was an adversarial relationship.
Right.
And
so you actually know how it works.
Yeah. And if you've got, and if I were to call, or a third party were to call on behalf of one of our customers and try to negotiate that, they'd treat me like a third party. So one of the reasons is we have the customers take the lead on this in terms of dealing with the provider, is because they're going to get better treatment. They are the customer of the hospital, of the physician. They're going to get better treatment. And second, they're going to fight for their own interests. If it's some third party saying, well, you billed $1,500, I don't know what that customer may think is fair. That customer might think $1,000 fair. They might think that bill should be eliminated completely. And that's their option as a customer and a patient to decide that. Now, the provider may or may not agree to that, and that's where you got to hash it out. But we always put that customer in the best position to get the best results for themselves. And so that's we're really geared towards, instead of what what some, you might hear the term patient advocate or billing advocate sometimes. And that typically is described as, hey, we'll try to negotiate a better deal for you on behalf of you. And, and when I hear that, and in practice, that means we're going to ask. We're going to hope they do something.
Yeah.
And patient fairness is structured very differently. We're looking for reasons to say, there's a reason where you can point to and say, based on a law, based on just fairness or economic transactions of a meeting of the minds has to exist on what this transaction was going to be. You're not asking for permission to or asking for a favor from the provider. You're telling the provider, I don't think I owe this as you build, and you better respond and give me some answers on these things. Otherwise, I'm not going to pay it until I get some answers. Now, I'm not saying you're going to get free health. We're not here to just give free health care away. But the customers.
But there is a fair price.
But there's a fair price, and there's certainly situations where the customer said a fair outcome is for me to pay nothing. Maybe I would have never had this service at all if I had known it was going to be $10,000.
Exactly. Maybe you should have told me what was going to happen.
Maybe $10,000 is a fair price, but that doesn't. I'm not going to pay it because I wouldn't have bought the service if I knew that.
Right.
And so that's up to the customer.
Medical is one of those weird spaces where we don't think about any of those things. We just go in, we listen to what the doctor says, and then we leave.
Yes.
And then, like you said, sometimes you get the bill and you're like, wait a second, they didn't tell me that this MRI was going to cost me this much money out of pocket. Like maybe I would have just opted out for that because that was kind of optional and I didn't feel like it was necessary, but they recommended it. So I was like, yeah, sure, we'll do it while I'm here, and then you leave and get this fat bill in the mail and it's like, well, hang on a second.
That's exactly right.
I never signed on a dotted line.
Right.
You never told me what this is going to be up front, which they never do, nor can they, because it seems like they kind of make it up at, by the seat of their pants whenever whoever gets it at billing makes the decision.
Well, they've done that for a long time. I mentioned the no surprise. There's a lot of new laws that have come around in the last 5 years, some at the federal, some at the state, where depending on the situation, they do have to give you a good faith estimate of what things are going to cost. And they have to do that in advance of service. They can't wait till you're right on the operating table. Like, hey, you're going to count down from 10 to 1. Before you do that,
also,
agree to this. They have to do it well in advance. And so there are some new protections that that give customers and patients a lot more protection than they had maybe 5 years ago. But I kind of frame it as most patients know when something probably isn't fair, but they don't know how to make that argument. You just have a feeling to say, I don't think I should have to pay this, but you don't necessarily know how to make your argument or what to base it on. And that's where we come in and say, hey, here's some laws that will help you cite. Here's some other things that show how much this really does cost them, things like that. So you can make your case and push back. It just requires, the insights that we have, and really from the patient and the customer, it asks them to stick up for themselves, and that's something new for some patients to do. But if you look at your personal life, and that's your line of work, people do that all the time in other situations. Right. If you get a burnt steak, most people don't have an issue to say, look, take this back to the kitchen. This was
not our agreement.
Give me a steak that was medium rare. And if you don't, I'm not going to be paying for the steak. Right. And so most people will do that. And we just want to make it easier and get good outcomes for patients, that when they have a reason to say, look, I'm pushing back on this, then they have tools and can do it with some level of confidence to say, sure, I'm going to get, I'm doing this. I'm looking out for myself.
How long have you been doing this now?
Just about 2 years. Okay. So I'm not a tech person. So this is all web-based. So a lot of that 2 years has been building out the capabilities of the website and programming things. But for the most part, September is when we launched a more full-fledged program version of our products. So
this is all across the country.
Yeah, we started out at the very beginning. We were just handling 3 or 4 states, and we went nationwide soon thereafter. So we handle anything in the U.S. We handle anybody whether they have insurance or not. Really, the only thing that we don't handle is if you have Medicare, Medicaid, or a government program. We don't handle that just because those customers already have protections under government programs that we don't want to charge for them accessing. But if you're uninsured or you have private insurance, we'll be able to help you for the most part, as long as it's a medical service.
Do you have any idea in terms of like an estimated figure about how much money you've put back into patients' pockets since you've started?
We don't publish that exactly. So we find success in about 60 to 70% of our cases have some reduction.
Wow.
Now, the interesting thing is a lot of our successes are not a letter from the provider saying you're right. You're so right. I should have never billed you. Most of our successes are the bill isn't coming anymore. I was getting it every week. Now I'm not getting it at all. Because the provider doesn't generally, depending on the situation, they're not going to confirm we've agreed. They just stop billing. They move on. And so
they just go to the people who aren't going to dispute them.
And so that's I don't know if you call it a drawback, but it makes my life a little difficult sometimes to say, okay, how much was saved? Like, well, if you're never going to see that bill again, you just saved 100% on that bill. But since the provider never confirmed they're not sending you the bill, you've just noticed it's not coming.
Right.
It's often hard to, which column do
attribute
I put that in?
Yeah,
But that's the way it generally works, is because providers, for right or wrong, are generally not admitting they're wrong unless it's a situation where they might agree on, okay, we'll accept this amount as a payment. But if it's entirely forgiven, generally the bill just stops coming.
Yeah, they just go, there's other people that will not fight us.
That's right.
We'll work with those people.
Yeah, or if I'm getting accused of breaking a law, it's like, I don't want to admit that. Let me just stop billing and make it, forget it ever happened.
Black and white.
Right.
Yeah.
So there's a variety of reasons why they don't want to acknowledge anything went wrong. They just quit billing.
So this is a perfect example of solving a problem in the market. That's why I love this business and was stoked to have the conversation, because I've never been more aware of the problems in our healthcare system after the last year or so of battling healthcare system, the healthcare system. And I'm an entrepreneur. My wife's an entrepreneur. We don't have benefits through a company, so we get the privilege of paying crazy high monthly premiums, only to be frustrated when we actually need something done. It's like, we're young, otherwise healthy. We take care of ourselves. We eat pretty good, go to the gym. We do all those things, but we get rewarded with these fat monthly payments. And then when I finally actually have to use the damn thing, they still send me massive bills in the mail. The copays are still large. It's like, this is so crazy that I have to pay all of this just in case something might happen at some point, and I need this, $200,000 procedure. Like, that's really the only reason that this even is something that I'm still willing to pay.
Right.
Otherwise, I would just probably switch to like an HSA or something like that and just put the money directly in there instead of having to pay insurance on it. Yeah.
I mean, a totally different conversation, but one that sounds like it's worth having at some point. Yeah. Insurance used to be catastrophic. I got in a car accident. It's really serious. It's covering things that I didn't expect for and reasonably wasn't, aren't able to pay, versus suddenly now it's not suddenly, but over the years it's covering preventive care, every type of thing you possibly are getting. Yeah. And that's not always the best way to use insurance.
Yeah, it's the insurance companies mining for more money, essentially. Like, they're looking at the business model and saying, like, we have this bank of customers. Instead of worrying about getting new customers, why don't we just add additional services in for our existing customers?
Yeah, either the insurer does it on their own, or there's a mandate where the government says, oh, you have to cover this service. And so whatever the reason, and getting back to your situation, when you do use it, you say you're shocked at how much it costs. Well, that was one of the more upsetting things in my line of work when I worked for health plans, is sometimes I'd be in a negotiation with a hospital like, well, we really need $2,000 for this MRI. And I'm looking at, on your website, you say you'll charge cash people $500.
Right.
Well, that's for cash people.
Right. Well, why is it different?
Like, why?
That blows my mind.
I'm paying you millions of dollars,
right.
And you're not going to.
I'm buying in bulk. And you're charging me more.
Right.
Like 4 times more. You're not talking about like an increase of 20%. Here.
Right.
We're talking about an increase of like 400%.
So mind-numbingly
frustrating.
That third-party reimbursement has really sort of distorted so much. That's why on the patient fairness side, we're trying to say, look, let's throw all that out and just make you a consumer. You already are one, and let you stand up, because that isn't fair.
Yeah.
Even if your insured negotiated $2,000, God help them, that doesn't mean you as a patient shouldn't say, look, I should not pay a $2,000 on a deductible for something that's worth $500 according to your website for self-pay patients. And that's all opportunity for the patient to say, I'm going to stick up for myself. And unfortunately, insurers and other parties have not proven that they're able to stick up for the patients in that regard successfully the last 15 or 20 years. So patients have to do it themselves.
Now, is this your first entrepreneurial venture?
It is. How's
that been going?
Excuse me?
How's that been going? How's the difference been for you?
I like it just because, I'm not the person that, I don't, a lot of people when I was younger, I got out of the rat race. That's not,
Wasn't a motivator for you?
It wasn't so much. There was obviously corporate decisions I didn't always agree with, but it wasn't so much. Being my own boss is just the ability to say, look, I want to do things my way for a change and not have to. Like for example, one of the prior health plans I worked at, I came up with some of these concepts to say, hey, maybe there's all these state laws, and maybe we could make sure we educate every patient about their state specific law. Yeah. And I brought that up in a meeting, and the guy in charge of it looked at me like, are you crazy?
Laughed you out of the room.
We're not going to spend time going to all 50 states. And I'm thinking, but that could make a huge difference to somebody that living in the right state. Yeah. That's not what we're a national company. So it's not so much, being an entrepreneur as just getting to a point where it's like, I just want to try it and do things my way.
Sure.
And see how that works, and not have to worry about other divisions in the company or what other people think about. And so there's a lot of freedom that goes with that. It's a lot of responsibility, and a lot of things that used to be done for me are not done. I just work out of my home currently, but ultimately at some point, hopefully I'll have an office, and then I'll have to worry about the electric bill and other things. But that's worth it in order to have sort of influence and say over how things are run. And we wanted to be a consumer, a patient-oriented company, and really try to change healthcare. So that's what we put that. I'm not independently wealthy. I want to make a living at this.
Of course, yeah.
But I don't want to make a living at it for the sake of just adding on to the problems healthcare already has just to make a buck. I want to do this so actually consumerism gets a foothold, and patients can take advantage of that.
That's what I love about the concept is I've said that to a number of people going through all the frustrating things about healthcare recently. I'm just like, I know there's a bunch of problems, but I don't think the government is going to ever be the one to solve those problems. I think America's in a unique position that puts us in a place where it's probably going to be people like you. It's going to be entrepreneurs looking at problems and coming up with solutions to solve those problems in a much more consumer-focused way rather than a profit-focused, shareholder-focused way, which is what all these massive insurance companies are obviously more worried about.
Yeah.
So thank you for stepping into the gap there and providing something that's actually a good service for people. What is your overall thoughts on this kind of Make America Healthy Again campaign? Do you think that's going to do anything to insurance companies? What's kind of the inside scoop on that?
Oh, no.
From your perspective.
This is just my own perspective. I think some people we'll see. If you're talking about the Robert F. Kennedy Jr. So, there's a lot of value in living healthier lives. There's no doubt about that. And a lot of Americans don't live healthy lives. So I'm all for the idea of trying to get people to make the right choices in life. But my own bias or opinion is most people realize they're not doing healthy things, and they still do them. I'm not necessarily optimistic or see necessarily a huge change coming down the pike. And that's you mentioned, solutions don't always come from government. Sometimes they very rarely come from government. So I'm not expecting to see insurers or providers suddenly see big drop in disease rates and those types of things where they have few patients because everybody's getting healthy thanks to Bobby Kennedy Jr. But I think it's fine as you know, just like there's always health campaigns going on. In my day, I think it was Arnold Schwarzenegger or whatever might have been the one when I was in middle school or whatever that was promoting it. But it's so nothing bad to say about it, but I can't say I'm optimistic that it's going to make a big difference in our overall health or how we finance healthcare either.
When it comes to the money side, have there been any kind of principles or lessons that you've taken away now going from employee mindset to entrepreneur mindset? Has there been has your perspective on money changed at all?
I think the biggest change, and this is just entirely personal, is I'm incredibly frugal personally. So I go to estate sales almost every weekend. Yeah. I usually go on the last day because that's when the biggest discounts are. I'm all about saving money. And so the biggest change is for me to realize spending money on the business side is not the same as buying an expensive car that I never needed, that I can keep driving the car I have. And so there's
an investment.
It's an investment. Yeah. It doesn't mean I'm going to come out ahead on it. Maybe I won't get any return on that in a positive direction. But I should not look at it the same way I look at my personal spending. True. And so that's been a big mindset change for me. And then it also coincided with, not surprisingly, no longer having a paycheck coming in from a salary. Yeah. So kind of it's required an adjustment for me for sure. But that's been the biggest adjustment for me, is just separating the two and realizing smart spending on the business side is not a reason to feel guilty that I'm overspending like I would be on the personal side.
Yeah, you would actually be holding yourself back if you look at it in that way. Like,
now,
you have to be willing to spend money to buy back some of your time, to be able to focus on the things that only you can do. But this other thing that I was pulling the levers on, I can actually hire somebody at a cheaper hourly rate than what my time is worth to do that same thing. Like, you're actually limiting yourself if you bring that perspective into the business world, for sure.
Yeah, no question.
As we kind of get everything wrapped up here, where can people go to get more from you, to learn more about the services and things that you offer?
So our website is patientfairness.com. One word, nothing in between the patient and the fairness. And anybody that goes out there, you know, we describe everything and how it works and what it costs. And all you have to do is hit dispute a bill or learn more and open an account. Again, people upload the documents, and we'll come back relatively soon, if not right away, and say these are the issues we found, and the customer can make up their own mind about whether or not they want to pursue that. But we've tried to make it as easy as possible. I would just say, you know, we're all about trying to help the patient. So we're not looking out for ourselves first. We do charge for the service, but it is it's a type of thing that hopefully people that, if you want to stand up for yourself, we're giving you the tools and support to make that happen.
Sometimes making more money is just as simple as negotiating something that you shouldn't be paying.
That's true.
It adds more money to your.
It's amazing what kind of bills come in that we see. It's maybe not as shocking to somebody that's been in the industry, but I feel for our patients, and I'm really happy when they get a good outcome.
Well, I love this episode. I love first of all, just being able to put more money back in people's pockets, because that's what the show's about. But doing it in a way that's like, this isn't requiring any additional activity. We're not starting a new business here. We're not starting a side hustle here. Yep. We're just helping you get a better deal on the things that you're already going to have to pay for, which is really, really cool. So patientfairness.com. If you got some bills recently, like I did, and you are, like I was, wondering if you should be paying them, how much you should be paying for them, and you're just confused about the transparency behind them, patientfairness.com. Go check out some of the stuff that Matthew's putting out there, and I know you will not regret it. Matthew, thanks so much for doing this, man. This is eye-opening for me. I appreciate you stepping into an industry like that, being a veteran of the industry, to help bring some disruption to the space. Everybody else listening, tuning in, remember, money only solves your money problems. And then you're left with the problems that money can't solve, but they're a little bit easier to solve with some money in the bank. So let's solve that problem first here on the Travis Makes Money podcast. Thanks for tuning in. Catch you next time. Peace out.